Clovis offers the first vital watch assembled in the USA that has the ability to track personal vitals and collect data from standalone equipment and transfer this data through cellular technology to the health cloud. The watch will monitor the host health vitals from their wrist that include temperature, blood oxygen, heart rate, blood pressure, activity, sleep tracking, stress level, and abnormal heart rate, and will also collect measurements from other home monitoring equipment that Clovis supplies like the pill dispenser, glucose meter, and weight scale. The firmware embedded into the DR watch is designed to receive Bluetooth transmissions from the pill dispenser and the other standalone products, then upload the collected data to the health cloud using cellular service. This technological breakthrough was years in the making, and we commend Victor Tranning for his due diligence and fortitude of incorporating all of the complex features into the watch. The DR watch will remind the host when it is time to take their medication and record the time and date when the medication was taken.
As the patient's medical professional, the DR watch gives me information that is traditionally not available. Knowing if and when the medication is taken is good information. 50% of people who arrive in the emergency room over the age of 65 is related to under or over-medicated. Smart Diabetes Glucose Meter is FDA approved and designed for home monitoring use. The meter and software has too many features to discuss all of them in this video. However, the meter exceeds all the requirements a doctor would want, and no need for the patient to use a logbook to record readings. If the patient qualifies for continuous glucose monitoring, the Dexcom CGM product will communicate automatically with the DR watch.
The glucose test results will transfer through Bluetooth technology from the meter to the DR watch and then to the health cloud.
I can be alerted by text, email, or IVR if the patient is trending badly and is in need of assistance. I can also connect to my patient by text, email, or speak to them through the watch. Tracking sudden changes in weight, whether it's gaining or losing, is crucial, as these fluctuations may signal underlying health issues that could remain undetected without proper monitoring. I will be alerted when my patient's weight changes exceed the limits I have established for them.
It isn't only Clovis products that can connect to the DR watch. Any Bluetooth-capable product in the market can have connection with a small amount of cooperation from the manufacturer. The DR watch was designed to be the solution for multiple markets. The Remote Patient Monitoring Division of Medicare requires that the patient test a minimum of 16 times per month to bill CPT code 99454. A large percentage of patients cannot be reimbursed because of not testing enough to qualify. The watch tests vitals every 30 minutes all day and night, giving the RPM supplier more than enough test results to qualify. Another market that the DR watch works well with is the federally qualified health centers, and they are reimbursed through HCPCS code G0511. Similar to Medicare RPM, the patient must test their vitals a minimum of 16 times per month, and the watch does much more than the minimum. The third market is the Personal Emergency Response Service, referenced as PERS. There are many different companies marketing for this business, and they all have different apparatus they offer to their clients. Nothing they offer can also be utilized for the RPM or FQHC markets.
As a pharmacy serving the doctor's patients, I have the capability to provide the DR watch to patients through the doctor's prescription for RPM or RTM, and can also offer the patient the add-on service of Personal Emergency Service. This opens up another revenue stream for my pharmacy and also gives the patient an affordable and innovative solution that wasn't available before the introduction of the DR watch. The DR watch, equipped with GPS and the capability to gather client stats before an emergency, offers immense value to first responders and medical teams awaiting the ambulance's arrival at the emergency room. By simply tapping the watch face 3 times, the client activates an emergency alert. Following this, the built-in cellular SIM card allows the emergency response assistant to communicate with the client, and this communication can be directly transferred to the emergency team.
If you are a hospital or accountable care organization that wants to set up your outpatients for RPM, you can give them the watch and possibly sign the patient up for PERS at the same time. PERS as a standalone cash business for the hospital is a rewarding opportunity for a new revenue stream and offers a great savings for the patient to participate.
If you are a pharmacy or a retail outlet store, stocking the watch for local doctors to have an outlet to send patients is a valuable opportunity. However, when you add in the recurring revenue stream from purse, the watch becomes more attractive. RPM and purse are both booming markets, and you only need to stock one item to get volume from both markets.
For additional information or to place an order, dial 386-506-8139 or email Clovis at info@clovisrpm.com.